It all blew up in December of '05. I was actually in a cinema at a time, and there was a sudden explosion of light and colour in one eye. And I'd never had anything like this. I phoned an ophthalmologist friend who said, "Get yourself seen straight away." The man who saw me said that I had something under the retina. He wasn't quite sure what it was, but he referred me to a surgeon who specialized in ocular tumors. The surgeon, Dr. Abramson, had a look for himself, did some tests, and then told me that I had a malignant tumor, a melanoma, in that eye. I was terrified when he said this, because I had always thought of melanoma as a fatal diagnosis. But he said that ocular melanomas were much more benign. They usually didn't spread beyond the eye, though it was imperative not to leave it growing in the eye. One had to treat it. One could do this by radiation. He arranged the radiation of the eye, which was done early in the new year, and 2 months after this, some lasering to mop up any remaining malignant cells. Emotionally, I was tremendously shocked by all this. I think anyone is shocked if they're given a diagnosis of cancer, even a relatively benign cancer. The cancer made me think about death in a way which I had not done before. At least made me think that there was a time bomb, a threat inside me, which might at any time sort of take on a really malignant course. I mean, obviously, as one goes through one's 70s, one has a sense of time being limited anyhow, but I feel it's more sharply limited. Now I've got this thing inside me, this unpleasant companion, although I've tried to make a wager with it, saying, you can have the eye if you insist, but leave the rest of me alone. And I make belief that this bargain has been accepted and honoured by the melanoma.